Hello, everyone. Welcome. We'll just wait a few minutes as folks log in. My name is Allison. I'm the manager for our Essential Care Partner Support Hub. And as we wait for folks to log in, we'll get started shortly. Hi, everyone. For folks just joining, thank you so much for joining us today for this webinar. Really excited to have you as part of our session today. We're just waiting for folks to log in, and we'll just get started in a few minutes. So I think we will get started. Folks may join us as we go, but I wanted to first introduce myself. My name is Allison Kilborn. I'm the manager for our Essential Care Partner Support Hub. Really pleased to have you join us today, and we'll get started. First, I'd like to start off with a quick land acknowledgement. While of course we meet today on a virtual platform with folks joining across the province, I want to acknowledge that I'm speaking to you today from the traditional territory of the Haudenosaunee, the land of the Anishinaabe people, including the peoples of the Mississauga of the Credit First Nation and the Huron-Wendat Nation. This is covered by Treaty Number 13, and the Toronto, also referred to as the Toronto Purchase Treaty Lands. I've mentioned before, and this lovely watercolor depiction shows that I live within walking distance of the Humber River in Toronto, where I spend a lot of time. And this was a major trade and portage route for Indigenous people for many years and long before settlers colonized the area. And I feel incredibly privileged that I'm able to live, work, and play near this place and on this land. I invite folks to take a moment to reflect on the land where you are. If you're not familiar with that, we'll pop in to the chat an interactive map that tells you which territory or city or town you sit on. As team members at the Ontario Caregiver organization, we're always trying to learn a bit more about the lands from where we work, exploring how we can really be meaningful allies, and how we can support the recommendations from the Truth and Reconciliation Commission. And we do this to reaffirm our commitment and responsibility in acting upon those recommendations in the commission. Thanks so much, and we'll move forward. So if you can take a few minutes to introduce yourself in the chat. As I said, my name is Allison. Really happy to have you join us today. I'm very pleased to introduce my colleagues on the Essential Care Partner Support Hub with me. We have Fardosa Helene, our Knowledge Exchange lead, and Kaylee Forster, one of our implementation leads with a focus on long-term care. So really excited to have Fardosa and Kaylee leading our presentation today. And I will now actually pass it over to Fardosa, but really again, encouraging folks to introduce yourself in the chat, let us know where you're coming from and what your role is. And also encourage folks to also ask any questions throughout the webinar today. We will have a time at the end for answering any questions, but feel free to ask as many questions as you like. And now I'll pass it over to Fardosa.
Hello, everybody. My name is Fardosa. Very nice to see everybody. Thank you again for joining our learning session today. Before we delve into our learning objective today, I'd like to first talk about what we do here at the Ontario Caregiver organization, which I will refer to as OCO going forward. So at the center of our work, it's all about caregivers. We are dedicated to enhancing the lives of caregivers across Ontario, and this commitment holds true regardless of the caregiver's age, the care recipient's diagnosis, or their geographical location. We are also dedicated to enhancing the lives. We also collaborate with caregivers to create its programs and services, which are all free of charge. And a vital part of our collaboration is our caregiver advisory panel and working groups. These dedicated individuals contribute to the insights and guide our efforts and ensure that we remain attuned to the real needs of our caregivers. On your left, you'll see a diagram that visually illustrates the working of OCS advancing in well-being our caregivers. So in the green box, the first one, you'll see the directed caregivers programs and services, as well as the next one is the caregiver and public information, which aims to provide accurate and accessible information to caregivers and the public, empowering them with the knowledge and resources to navigate their caregiver journey effectively. We also have public awareness as well as caregiver insights and engagements. So at the core of it all, we continuously seek inputs from caregivers themselves, ensuring their perspectives drive our actions and initiatives. Lastly, we have system outreach and collaboration. So by engaging with broader systems and the organization, we work towards creating a more caregiver-friendly environment, fostering a collaboration that brings a wide spread of benefits. So this last point of the system outreach and collaboration and the idea of working with health systems to improve caregiver experience ties really well with how Essential Care Partner Support Hub came about and evolved. Next slide. So the Essential Care Partner Support Hub aims to provide support to Ontario hospitals and long-term care homes planning to implement or enhance an essential care partner programs and practices. Some of the offers that we do is guidance and coaching, leading practices based on organizations that have successfully implemented the program previously, offering resources, tools, and templates, as well as connection to settings and peers that have implemented. Lastly, we also offer opportunities for learning and knowledge exchange like this one. Next slide. So in today's session, learning objectives, we hope that by the end of this session, you'll gain an understanding of the impact of caregivers and the critical importance of linking caregivers to support for their own well-being, identifying leading practices and key strategies to support essential care partners in long-term care settings, as well as recalling programs, highlighting resources and tools that are available to support caregivers. We do also encourage any kind of question that you may have to input in the chat function. And now I'll pass it to Kaylee, who will be starting the presentation for the rest.
Thanks, Cardoso, for the introduction. I will get us going. So studies estimate that Ontario's 4 million caregivers provide 75% of the care in our system, a very significant contribution that emphasizes the critical role that caregivers play in this partners in care equation with residents and healthcare providers. Effective care partnerships make up a system of care with a broad and significant impact, and effective partnerships between residents, caregivers, and healthcare providers engage in meaningful partnership, collaboration between residents, families, caregivers, and providers working together to create system change. To quantify this contribution, in 2018, Ontario's family care work was valued at almost $43 billion. Far surpassing other provinces like British Columbia, Quebec, and Alberta. And not only are caregivers essential for effective care partnerships and resident well-being, but these numbers help us to better understand just how essential caregivers are for the stability of our healthcare system. Caregivers are making a significant contribution, as we just discussed, dedicating time and energy to their caregiving responsibilities. We know caregiving is complex and demanding, and many caregivers are challenged to balance personal and professional priorities with their caregiving responsibilities. Caregiving has an impact on every facet of caregivers' lives, and there is mounting evidence that caregiving should be considered a social determinant of health. First and foremost, caregiving can have an impact on housing, specifically as many caregivers often co-reside with the care recipient for long periods of time, and thus are often dependent upon one another's financial contributions. This has significant impact for those transitioning into long-term care, as not only does this present the momentous lifestyle change for the resident, but it can also have profound implications for the caregiver as well, who may be facing new housing challenges and subsequent financial issues as well. Caregivers may experience employment challenges, including a lack of work-life balance and a loss of income or benefits. Financially, there are often added costs for transportation, travel, accommodations, care services, supplies, and potentially accessibility modifications. Caregivers experience changing relationships with those they are caring for as well, evolving roles, especially in the context of long-term care. and a long-term care transition. Spouses and other familial relationships can become complicated or strained in the context of caregiving. And long-term care transitions may lead to role ambiguity, with caregivers unsure how they fit into the long-term care environment or how to identify after many years as a primary or full-time caregiver. Caregivers also lack time to nurture other personal relationships, and this can lead to feelings of isolation. Notably, there is also the fact that caregiving limits caregivers from prioritizing their own needs, often placing their own hopes, dreams, and goals for the future on hold to fulfill their caregiving responsibilities. Thus, they may experience a lack of time for self-care and attention to their own physical and mental health. As a result, the mental health implications of caregiving can be profound, and many caregivers report signs of psychological distress, including feelings of anger, irritability, sadness, isolation, and sleep disturbances. Caregivers also experience higher rates of loneliness, stress, and depression, and are more likely to be prescribed medications to cope. Caregivers are also more likely to experience deteriorations in their physical health and an increased risk of injury as a result of their caregiving tasks. Being a caregiver can negatively impact physical and mental health, and this is important to emphasize as we shift our discussion into ways in which we can support caregiver well-being and inclusion. However, it's also important to consider how caregiver well-being can impact health outcomes for those that they are caring for. Well-supported caregivers are more likely to provide better quality care. Caregiver mental health has been found to impact clinical and mental health outcomes for those they are caring for. Furthermore, caregiver burnout can lead to poorly managed care, resulting in unnecessary hospital admissions or emergency room visits. The national standards for long-term care also recognize the vital role of caregiver inclusion. And this image situates the caregiver or essential care partner as central to the resident-centered model of care. And this is one that considers residents' relationships, the impact that other people, practices, physical care, and the environment may have on the individual resident. This concept guides long-term care homes to move beyond family or caregiver involvement towards true family caregiver inclusion and collaboration. It's also worth highlighting as well the profound impact that COVID-19 had on caregiver well-being. And this slide just shares a few of our insights from our 2022 Spotlight Report, which is an annual publication that OCO completes and sends out. So 1 in 4 caregivers say their caregiving responsibilities have become more difficult since the easing of COVID-19 restrictions. And 1/3 are facing barriers in accessing the supports they need. Over 60% report reaching a breaking point, but had no choice but to continue. And 2/3 of caregivers say they have experienced feelings of helplessness and burnout. 1/3 of caregivers are spending 10 or more hours a week providing care. And this is a number that spiked during the pandemic, but has not decreased significantly since the reopening of community services and programs. And although the pandemic certainly highlighted the need for caregiver support, caregivers were struggling before the pandemic, and they continue to struggle today. I wanted to share a brief video that highlights a caregiver's perspective, because we know that as great as it is to share research findings and evidence, the best individuals to share the caregiver experience are caregivers themselves. So this is Sandy, and she is going to share her experience as a caregiver. And I'll just make a note to increase the volume on your computer if you can, as we know that this video is a little bit difficult to hear through speakers. A little bit delayed. Technical difficulty here. What I might do Let's just do this in a different way. My apologies. Okay, I'm having technical difficulties, so I'm going to skip the video, and we'll send this out afterwards. And got my computer. Put them back. So we'll send this a video out afterwards, and I hope that you'll watch it. It's very short and it highlights a caregiver who kind of discusses an experience or multiple experiences where she was politely greeted by healthcare providers on a regular basis and engaged in various ways. What she really wanted was for someone to just ask how she was doing. And had they asked how she was doing, she may have considered truly how she was doing and what she could do for her own well-being, whereas being so engaged in her caregiving duties all the time, she really wasn't thinking about herself, and with no one really asking how she was doing as an individual, it just didn't cross her mind. So I hope you'll give it a watch. Apologies, I can't seem to get it to play, but it is a great video to kind of give us some insight into how simple these strategies for supporting caregivers can really be, and we're going to dive into that a little bit more. So again, bouncing off of the video that I couldn't share with you, why is caregiver support not happening? And maybe it is in some settings and it is in others, but we're sort of speaking about what are the barriers to consistent caregiver support. First and foremost, healthcare providers are caring for residents in the long-term care setting. And we recognize that you healthcare providers are very busy managing competing priorities, responding to critical incidents, health complications, communicating pertinent information to family members, allied health, managing staff challenges, and of course, meeting regulatory requirements. It is a very full plate. The long-term care environment is fast-paced and demanding, and caring for caregivers is just not simply something that can be reasonably added to this long list of responsibilities. Couple this with the fact that healthcare providers may not know how to help, may lack knowledge of or access to resources that could support caregivers or strategies that could enhance collaboration. On the other side of this equation are caregivers, and they are primarily focused as well on the needs of the care recipient and managing their own burnout, lack of time, financial constraints, and challenges associated with the stigma of caregiving, especially in the long-term care environment, which can leave a caregiver feeling a bit lost and unsure of their role and purpose, as we mentioned earlier. You may also feel burdensome asking for help or information and may have a limited understanding of long-term care culture and potentially unrealistic expectations of the care team. So an essential care partner program provides an opportunity for organizations to formally recognize and partner with caregivers and really build that culture of caregiver inclusion, ultimately reducing those barriers to caregiver support, improving trust and collaboration. ECP programs not only improve the caregiver experience, but as we know, they have a positive impact on resident health outcomes as well. Each organization's ECP program may vary slightly, but our goal at OCO is to support greater consistency across all healthcare settings and establishing ECP programs that identify the caregiver, include the caregiver, and support the caregiver. We'd like to do a quick poll right now, just to get an idea of what you and your organization are doing. And if you have an essential care partner program, if you're interested in developing an essential care partner program, we'd love to get some feedback from the attendees on the call. We'll give a 30 seconds or so. So we have, yes, but it needs some improvement, and I'm not sure. So that's great. And hopefully have a little bit more clarity at the end of this presentation. Okay. So, diving a little bit deeper into what exactly is an essential care partner program, we have here our leading practices. So under each pillar, identify, include, and support, we have key leading practices that guide ECP program development and delivery. And some on the call may be familiar with these practices if you've connected with us before at the ECP Support Hub, and for others, this may be completely new information. Our primary focus for today is the support pillar and some of the leading practices there. But before we dive into that, we just wanted to touch on this sort of foundational component of a successful ECP program, which is establishing a very clear differentiation between an essential care partner and a general visitor. And we've noted some of those key differences here. So essential care partners are directly involved in care tasks, health management, and or emotional support, and they are essential to the well-being of the resident. They may or may not be the resident's substitute decision maker, while visitors, very important to meet the social needs and companionship needs of the resident, have a limited or no direct involvement in care tasks. This differentiation is critical for residents, staff, visitors, and ECPs to understand in order for your program to really be well understood and ultimately successful. Establishing this role clarity is quite important and foundational. So sort of shifting back to looking at that support pillar and starting to explore some of the leading practices under that pillar, and again, some of the tools that may be useful to you. We're going to dive a little bit into these top leading practices, the orientation, education, and training, and link to support. And when we use the term support, we're sort of twofold here. We're considering ways in which we can support the caregiver well-being and link them to resources and supports, while also developing tools and practices that aim to support and set caregivers up for success in your specific organization. So our first leading practice is the ECP orientation. This is an established process that ensures essential care partners are formally welcomed and provided with an initial understanding of what to expect within your unique organization. Practice sets ECPs up for success in their role and establishes a strong foundation for collaboration and accountability. This might include providing an essential care partner program package in a digital or print format that includes important information about the organization, the building itself, specific codes, secure and non-secure areas, safety protocols, emergency response systems, services that may be available in the home, and wayfinding. Materials could also include information about the ECP role, including a mutual understanding of responsibilities of team members and care partners, as well as making essential care partners aware of who to contact if they have questions or concerns. Orientation may include a tour of the care setting and the family or caregiver resource center or area, if that's applicable in your organization. Orientation to common spaces, multi-faith spaces or prayer rooms, introductions to key members of the care team, and an overview of staffing complements and shift schedules, an opportunity to demonstrate the safe operation of key equipment such as call bells, and guidance on signage or communication tools such as a whiteboard if you use that in your organization. To support onboarding and orientation conversations, OCO has developed adaptable templates or scripts with the goal of supporting healthcare providers to communicate effectively and confidently about the ECP role and the program itself. These scripts are fully customizable to meet the specific needs and requirements of your organization and will be distributed as part of our package in their follow-up materials for you. Our second leading practice in that support pillar is the establishment of education and training processes and activities with the goal of supporting the success of ECPs in your home. This may include in-person or group or one-on-one training videos, written materials. When possible, we suggest offering an online training option for those who may not be able to attend scheduled in-person sessions. Important to clarify with essential care partners what, if any, education training is mandatory versus optional, and the necessity or opportunity for ongoing training at routine intervals, semi-annually or annually, to align with organizational or regulatory requirements. Education could include the following components: information on infection prevention and control protocols, key aspects pertaining to their role, including how they may wish to participate in care, information on how to partner effectively with health professionals, basic understanding of privacy and consent as it relates to the care partner role, and what to do in the event of an emergency. You can also further explore more specialized training based on your organizational priorities and caregiving needs on topics such as fall prevention, basic skincare, safe lift and transfers, and beyond. It's really sort of yours to do what you'd like with it. And you can certainly continue to offer education on an ongoing basis, as we know that in long-term care, your relationships may be long-term in nature, and residents' care may change over time. To support this, we have free of charge self-directed e-learning modules for caregivers. And these courses were created in collaboration with caregivers and healthcare providers. Caregivers partnering with health professionals e-learning provides information about the value of the caregiver role, how to effectively communicate and partner with healthcare professionals. And these modules can be accessed through our OCO website. The last leading practice we want to touch on is connecting caregivers to support for their own well-being. And as we discussed earlier, this is critical for building resilience and preventing burnout. We encourage you to consider opportunities for care partner screening and further assessment in your homes as well to identify unique needs. Caregiving and the caregiver are multifaceted, and they may have unique needs considering social determinants of health, caregiver's environment, the resources they may have, and their own intersecting identities. Support materials provided to ECPs should contain resources that outline where the caregiver can go for help. Materials such as brochures can be made available in common spaces or designated caregiver support areas. Posters can be posted in high traffic areas, and caregiver resources and links to local community support could be shared in regular print or digital communications such as monthly newsletters or email blasts, shared in resident town hall meetings or family council meetings if applicable in your home. All staff can play a role in recognizing caregivers in distress, connecting them with support. This really begins with ensuring staff are adequately informed of where caregivers can obtain resources or seek additional information. Some of our free caregiver programs and services to support caregiver well-being. These are no fee, no referral needed, and accessible for all caregivers across the province. We have our 24/7 helpline where caregivers can call 24 hours a day and be connected to a real person for support. They can also text the helpline Monday to Friday between 9 a.m. and 7 p.m. if they're more comfortable with that option. And based on the caller's location and specific needs, the helpline can link caregivers directly with local community supports for ongoing assistance. And the helpline can also be accessed by healthcare providers. Healthcare professionals can contact to help find specific resources suitable to a particular caregiver or situation. So all open to everyone. Also offer peer support programs, both a one-on-one option as well as a virtual support group platform. And we offer education, monthly webinars on a wide range of topics aimed to be practical and useful for caregivers, from safe lifts and transfers to financial and legal advice. All of our webinars are recorded, and we link to all of these recorded sessions on our website. OCO also produces a podcast called Time to Talk, and we have, as mentioned, an online learning library with a number of courses for caregivers, as we previously mentioned. We also have our SCALE program, which is our support for caregiver awareness, learning, and empowerment program. This program really aims to empower caregivers with practical information and skills to enhance self-awareness with a focus on one's own emotions, needs, and well-being. It runs twice a year and consists of a series of 8 webinars facilitated by contracted mental health professionals. Caregivers can attend some or all of these sessions live or access the recordings. And those who register for webinars may also choose to sign up for limited individual or group counseling sessions with the facilitators during this 8-week program. These sessions allow one to dig a little bit deeper and work through their emotions related to the caregiving experience. Registration for our October scale program is open now and can also be accessed on our website. We also have a number of resources and toolkits for caregivers, including a suite of privacy and consent resources for both caregivers and healthcare providers as well, which includes some helpful FAQ documents and a training tool for healthcare providers. We also have a contingency planning workbook to support emergency planning for caregivers as they look to the future for any unexpected changes. We also have a toolkit specifically designed for caregivers supporting senior with useful information on system navigation, frailty, fall prevention, and more. We also know that not every long-term care home has a family council. And for those that don't, we recommend connecting directly with Family Councils Ontario, who work with long-term care homes in Ontario, families, staff, to enable them to cultivate positive relationships, build effective family councils, and improve the long-term care experience. Family Councils Ontario also has a monthly e-bulletin that contains really helpful information for caregivers to access as well. So what do we have coming up next? We have a webinar in September, and it's titled Understanding Healthcare Consent Laws and Rules, scheduled for Thursday, September 21st. Anyone can register, again, through our OCO website, the events calendar section of the website, or directly through Eventbrite for our webinars. And then we also have our weekly 90-second caregiver newsletter, which you can subscribe to, and that provides key information, practical tips, and tools to support caregiver health and well-being. Finally, we also have a number of print resources that we would love to share with you, whether you're considering enhancing or implementing an ECP program, or you simply want to boost support for caregivers in your home. We have a variety of posters, postcards, lanyards, and more. So please just send us an email and we're happy to put together a package for you that meets your needs. That is for my section, and we'd love to open things up for questions. If anyone has anything you'd like to ask in the chat or feel free to type any questions into the chat. We also have another poll here. So interested in knowing what kind of support for caregivers do you currently offer in your organization? So referrals to community supports, in-house caregiver support groups, resources, pamphlets, or information for caregivers, education or information on specific topics, or other, feel free to comment in the chat. Let me give that 30 seconds. In-house caregiver support groups, education, information for caregivers on specific topics. Thank you. Thank you for participating. I might pass it back over to Fardosa to share a few more slides.
Perfect. Thank you, Kaylee, for the wonderful presentation. So as we now come to the concluding part of our presentation, the learning session, we welcome anybody or everybody to join our Learning Collaborative, which is an interactive forum for healthcare providers. Sorry, next slide, yeah. So yeah, this is the Join the Learning Collaborative for healthcare providers to share information, experience, and simply engage in any discussions about ECP programs and caregiver organization. Caregiver inclusion, sorry. Our next session is scheduled for September 28th at 1 p.m. and you can register by emailing us at the email noted there. Next slide. So on this slide, we want to kind of give a key takeaways and resources from today's session. The first one being providing essential care partners with the information, resources, and educations they need to be successful in their role, as well as connecting caregivers to support and resources for their own well-being, being to reduce burnout and improve healthcare outcomes. Key resource here is the key messages for an onboarding conversations with patients and essential care partners, as well as partnering with healthcare professionals through e-learning. We also wanted to kind of give a reminder for the OCO 24/7 Caregiver Helpline, which is helpful. Next slide. And if you have any questions, whether it was from today's session or they would like to join the Learning Collaborative, please email us at any of the emails above here. And then please join our quarterly Partners in Care e-bulletin for providers. We also have a number of social media accounts. So if you would like to follow us there, we'd be happy to. That's it. Please, we do have a survey. It does take a few minutes, so we'll appreciate if you can do the evaluation for today's session. It'll give us opportunity for what we did right, and if you have any feedback on how we can improve for our next session, we'd also appreciate that one. Thank you so much.
Thanks so much, Ferdosa and Kaylee, for a great presentation. Tammy, great. We'll follow up with you. Thanks so much for your comment in the chat. We'll enter our survey information link into the chat now, but we'll also send that as a follow-up as well, and really look forward to connecting. If you ever have any kind of questions and follow up to today's presentation, please don't hesitate to reach out. And we look forward to being in touch with you again as well. I'll just pop the survey into the chat now, and please take the time to complete that. Thank you again, everyone, for attending today, and look forward to connecting in the future.